Everybody. Hi there. My name is Brent Stevens. I'm the superintendent of Berkeley Unified School District. Thanks so much for agreeing to spend a night out, a virtual night out. This is a town hall for and in a sense by parents of students with disabilities to talk about special education services here in Berkeley Unified. We're at the cusp of a very interesting change that will begin to take place in just about a week and a half. And so we hope to be able to offer lots of information, which we hope will be helpful to special education families. We'll begin in just a few seconds. I want to give everybody a chance to log in. Please know this evening that there's going to be lots of opportunities for interaction. We do plan to have live questions, and if you see the raise hand button on your Zoom screen, that's the best way for you to get in on the live question asking. We'll also be responding to written questions submitted by our parent viewers through the Q&A function. So down at the bottom sort of right-hand side of your Zoom screen, you should have a button that says Q&A. That's an opportunity to ask written questions. We plan this evening to offer a relatively brief presentation. I think we're probably going to do something like 15, maybe 20 minutes of information about this transition taking place in our district. We've really worked in advance of this meeting to sort of customize the information that we'll share, particularly for the perspective of families of students with disability. We'll talk a little bit about the transition to in-person learning, about distance learning at the elementary level, and then talk about the sort of interplay between common safety practices that will be implemented on our elementary campuses and common special education teaching techniques, the ways that they work together and the ways that we might be experiencing some complications. So we'll offer that information, or rather the special education team will offer that information, and then we'll jump into what I think will be an extended period of sort of questions and discussion. Before we do that, I'd like to begin to introduce everybody who is serving as a sort of co-panelist or co-moderator this evening. We've got a great group of both staff, parents, and a member of our school board. So I'd love first to start with our parents. We had an opportunity before we went live to practice introducing ourselves. We did okay, but we can do better. So Vicky, maybe I could go to you first. You could introduce yourself and then help introduce our parent panelists.
Hi, my name is Vicky Davis. I'm a parent of a 7th grader at Longfellow Middle School with an IEP and a 1st grader at Malcolm X. I've been active in special education and the PTAs as presidents for 8 years. And we'll go ahead and go to Eliza. I also moderate the BSPED parent listserv, and this meeting came out of that listserv. Eliza?
Thanks, Vicki. My name is Eliza No. I have kids in primary, middle, and high school, and all of them has either an IEP or 504 plans. Next, I guess I'll popcorn to Carrie.
Hi, so I'm sort of like the novice and the one with one child, newly at Oxford, 3rd grader with an IEP, and I'm on the PTA at Oxford. I will transition it over to Andrea.
So Andrea is not going to be a panelist, but we'll go ahead and have Sarah go. That's okay. Go ahead, Sarah.
Hey, my name is Sarah Bowles. I have kids at BAM and MLK. Both are mild to moderate, and I just want to give a plug for BSPED's new website, which is bspedparents.org. We're going to have more material coming soon to help the community work together.
Fantastic. Welcome. And now let's do the same for our special education staff members. We are saving the best for last, Director Vasudev. Don't you worry. So we're going to go over to Executive Director of Special Education, Sean Mansinger, and he'll do the same thing with his team. Introduce everybody.
Good evening, everyone. I'm so happy that you're here to join us. I'm Sean Mansinger. I'm the Executive Director of Education. I'm very proud to be at Berkeley Unified School District. Let's go ahead and jump over to Eileen Jacobs.
Hi, I'm Eileen Jacobs. I'm the program manager at Berkeley High School. Alyssa.
Hi, Alyssa Lund, a program supervisor for Berkeley High School. And Lena.
Hi, good evening, everyone. My name is Lena Sweeney. I'm a program supervisor with the middle schools and with Cragmont Elementary School. And I will pass to Florian.
Hello, I'm Floran Palma, one of the SPED program supervisors. I'm supporting 7 of the 11 elementary sites. Do I pass it on back to you, Dr. Stevens?
Great. And let's also invite our esteemed board colleague, Director Anu Vasudev, to introduce herself. Welcome to you.
Hi, everyone. I'm Anna Vasudev. I'm a member of the Berkeley School Board, and I'm also the mom of a kindergartner with an IEP. Very grateful to be SPED and to all the parents that are here. And I hope that today's town hall brings much needed clarity to the community.
And then also just a special shout out to Jessica Lopez Tego, who is sort of behind the scenes with this meeting. She's been managing this group of panelists, helping us all be coordinated and setting up tonight's event. So Jessica, thank you as well. Jessica is now on town hall number 3 in less than a 24-hour period. So let's give her props. We're about to jump into a presentation. What we hope we've done tonight is put together some information that builds on information that's already available to the community. Over the last several weeks, we've been sending a series of communications, both to elementary, middle, and high school families, most focused on elementary right now, that describes both our plan to return to in-person learning, our plan to reconstitute the distance learning program, both sort of upgrade that program, but also make some instructional changes. And these changes raise a number of very important questions about the provision of special education services to students with IEPs in the district. There's questions both about how it will work, given that our staff will now be working both in person and online, truly sort of living a hybrid work experience. But then there's lots of questions about common health practices, like stable groups, like social distancing, like essential protective equipment, that naturally raise questions for parents of students with disabilities about how all of this is going to work. So tonight we hope to be able to offer our very best perspective on how things will work. We hope that you'll keep in mind as well that some of these things are new to us as well. As we move into sort of robust in-person learning program for elementary schools in only a week and a half, that our staff will also be learning alongside of families and be working to resolve a whole set of problems as they encounter them sort of live and in real time. So with that, I think, Sean, I'm going to turn it over to you. Do I have that right? You'll be sharing your screen and you'll lead the team through what will be a presentation of about 15 minutes or so.
Absolutely. Eileen, can you share your screen, please? Right. So good evening, families of students with IEPs, as well as BUSD staff, labor partners, community members that may be joining us. Thank you for taking your time this evening. I know you've been anticipating this meeting and there's been a mixture of excitement and anxiety for our current reopening plans. I'm hoping from this evening, just echoing Dr. Stevens, that we can continue to deepen that dialogue that needs to be ever present when using a community approach to serving our students with disabilities. I also hope our presentation followed by our discussion afterwards will help relieve some anxiety that you're feeling. I want to acknowledge that there are still many logistical pieces being determined, such as scheduling, and we are working minute by minute to prepare our whole team. So we will be prepared when it's time to open up, and we will be equally supporting our distance learning families as well as our in-person families. So it will feel like a little bit like the first week of school as we're coming back in, and there will be some bumps. But we are all committed to this work and we're ready to partner with you. Next slide. So we'll be doing a few things. We're going to be going over some of our services that we'll be offering through distance as well as in person. We'll be reviewing COVID safety in BUSD schools to make sure that everyone feels that when their children come back and staff come back, that they feel safe. And then again, we'll do a question and discussion afterwards. Next slide. So this is actually a new logo that we have, and it's wherever you learn, we learn together. And I think it's an important, I personally consider myself a lifelong learner, constantly make mistakes, and we learn from those mistakes and grow. So this is just a reminder that no matter if we're in person learning or we're distance learning, we are committed to do this together, to grow together and make mistakes along the way together, and then strengthen and get better at our practices. Next slide. So the first section we're going to do is go over some of the safety and how it relates directly to special education. We know first and foremost, again, that our special education students are general education students. So any of the safety practices that we're using for all of our students apply to our students with IEPs. And then, of course, there are some that might be specific to the student needs. Next slide. So here are some of our key safety practices that we're using in Berkeley Unified School District. And these actually go a bit beyond what the California Department of Health is asking. Of course, we're going to have face coverings and personal protection equipment for all of our staff as well as our students. We're going to be practicing social distancing, staying at least 6 feet as far. It could be from 4 to 6 feet. We're going to be really focusing on stable groups and ensuring that we're not having stable groups mix. Lots of hand washing and sanitizing, regular cleaning of our classrooms as well as materials and equipment. We have ventilation in all of our schools, not only our central systems, but also ventilators in each of the classrooms. We are, of course, working hard to get all of our staff vaccinated, and I feel like doing great progress with that. We're going to be doing symptom screening and surveillance testing and contact tracing if cases do arise. And we've actually hired additional nurses to help with that practice. And in addition, all of our staff are using a platform called Keenan that will be providing the additional trainings on these areas. Next slide. So physical distancing in special education. So our classrooms will be set up. Our principals and have been working really hard going into classrooms and setting up and maintaining and setting up desks in order for us to maintain the physical distance that we'll need between students and staff. Students' chairs are spaced at 6-foot intervals or no less than 4 feet if necessary. And we're also looking into utilizing outdoor instructional spaces, possibly for intervention classrooms. We also might be using a library. We're going to be more creative with the spaces that we're using at our school, because we know that since we are creating stable cohorts, we are going to need additional space. And that is a challenge, but we're working our way through that. And our principals are working very hard to make sure that happens. And then we'll, of course, use outdoor spaces as appropriate. Next slide. So personal protective equipment, we have ordered a lot of it, and it's ready to be get to schools by the time we open. All of our staff and students will be required to wear face coverings unless there's a medical accommodation or a documented disability, which I'll explain in the next slide. Some staff, not just our moderate severe special education and pre-K staff, but they may wear gloves, they'll have face shields with drapes, N95 respirator masks or gowns when direct physical support is needed. So for example, for diapering or feeding for some of our students. As an added level of precaution, we will also have plexiglass screens available. Clear face masks have also been provided. They'll be provided to staff and some of our students who are deaf and hard of hearing. And then, of course, we're going to be reminding everyone that if you feel sick or have symptoms, we're asking them to stay home. Next slide. Exemptions to face covering. So here's just a few, and I know it's a concern for a community. If even walking in the street, sometimes we see somebody without a mask, and we've become so accustomed to wearing them. But we also know that there are exemptions for some of our students. So if a student's unable to wear a mask because of the student's disability, the IEP team will review that, and the IEP team also includes the parent, and we'll discuss alternatives. So maybe it's a face shield with a drape. Maybe there will be behavioral supports to help support that process, social stories. There could be a plexiglass partition put in between, and then other staff will be given additional PPE if needed. If the IEP team determines it's not due to a disability, then a medical waiver may be required. So the district nurse will support site teams with this determination, and forms will be provided to the families to fill out. So what if there is a child with an exemption in your child's class? So measures will be taken to ensure the safety of site and staff. So again, like I said, it might be additional PPE gear that's provided. There might be plastic partitions that can be utilized. The rooms are all well ventilated, and will again, of course, keep 6 feet apart as much as possible. Next slide.
Can you go back one, Eileen? Okay, stable groups. At the preschool and elementary levels, students will be kept in stable groups with fixed membership. So no student will be assigned to more than 2 stable groups. One is the school day classroom stable group, and the second will be the after school stable group. For the school day stable groups, students will stay together for all activities during the school day, including instruction, snack, lunch, and recess. The after school stable groups, and this is only for the elementary sites, every effort will be made to maintain cohort groups from the school day during the after school program. Next slide, please.
So there's a lot of information on this slide, so I'll walk through a little slowly. So our special education teachers will work, of course, with our related service providers, as they always do, to develop these daily schedules that are going to maximize the provision of service to students. We know this was it's been a challenge all year, and it's going to continue to be a challenge due to our stable cohorts and having to maintain them. Of course, we are always using the original IEP to determine services and student needs. It doesn't change. We'll document all of our in-person learning, our virtual learning, and our asynchronous work in what is a learning emergency plan. So you're probably wondering, well, where did the D go? Since it's not distance, we're using a combination of different strategies in order to serve the SAI minutes or the speech minutes. And so we're calling it the learning emergency plan. It's going to look exactly like the distance learning emergency plan. And for those folks that are still in distance learning, we'll just continue with that distance learning emergency plan. And there might be changes that are done to it if we have to adapt schedules. But that will be done in cooperation with parents. We do not require signature on that, but it is always in cooperation. So it'll look very, very similar, and it's an easy tool for parents and teachers to be able to see the exact services being provided to your children. So when providing these services in person, the following guidelines are reflective of the California Department of Health. We're always looking at those to maintain safety. So work with students can only be with one stable group at a time. So for example, a case manager may go into one cohort and they may pull a group of students out of that cohort and do that work. However, they can't mix a cohort with another cohort. So that becomes a little bit of a challenge, right? Because normally in a normal year, we might pull a 5th grade student, a 3rd grade student, 4th grade student. As long as they're working on a similar goal, we'd be able to work with their SAI or their minutes with them. But unfortunately, now we're going to be forced to work with just one cohort. So we may, if we pull in a separate group and pull out, we'll be making sure that that space is clean and sanitized before we pull from another small cohort. We also might be maximizing time outside and doing instruction outside in order to support. Of course, that needs to be a space that's quiet and not distracting. We're going to continue to maintain more than 6 feet of distance between students and teachers as much as possible. And of course, we know sometimes we need to get closer to our children and do a hand over hand support. And in that case, there will be the extra PPE that will be provided. There might be also instances. I was talking to one principal who has that have laptops in a room and headphones, and in the back they may be in a group and they might be getting some of their virtual instruction from their special education teacher or speech and language therapist. that will provide them their minutes as well. So going back to that learning emergency plan, all those will be documented in different ways in that learning emergency plan. And as you can see, it's going to be very complex, and we are asking patients from families for our case managers and our related service providers to develop these schedules, much like at the beginning of the year. Next slide.
And during the transition period, as Sean has already alluded to, our special education teachers and service providers are going to be working very closely together to ensure that service schedules are aligned with the family enrollment choice. So again, this might feel a little bit like the beginning of the year, and there's lots of factors to include when we're considering scheduling. Some of those considerations for our teachers are the start and end times of the school day and the in-person learning opportunities. Safety related schedules as they pertain to things like recess, lunch, and specials at the elementary level, such as PE. And some students will be on campus while some will maintain distance learning. So there are a lot of factors that our teachers and service providers are considering in developing these schedules. In addition to the curriculum, some of the focuses will also be on social emotional lessons, community building as we're returning to in-person instruction, and learning new routines as they pertain especially to the safety of our school sites. Next slide, please. Oh, okay, so one of the things that we've been working on in anticipation of this return to in-person instruction are some additional expanded special education staffing. Some of the positions that we've been working on expanding are instructional assistants and paraprofessionals, registered behavior technicians, speech and language pathologists, and other related service providers. Next slide.
If I can add one comment to that too, Alyssa. So I think one thing that's important to remember, because I know some of the feedback from families have been, well, you know, why aren't we hiring more teachers and this and that? And, you know, I just want to say, you know, it's every district right now and every agency is really having a hard time finding people. We are looking at how we can provide additional staff for next year and planning in that process. But it is quite the quandary right now. And a challenge. For example, you know, we've contracted with a couple different agencies to get more instructional assistants, but those agencies also are struggling to find folks. So we've done a lot of work on trying to expand our services much so we can meet the needs of our students. And I just think I want to be transparent about that with our community.
This seems like a good time to interject a question. We had a question about vaccinated staff and whether or not there'll be staff on site before they're vaccinated. So in the essence that you might be hiring new staff, will those staff be vaccinated before coming to campus? And can you talk a little bit about that?
I can, Vicky. Thanks for the question. I'll answer it in two ways. Sort of first, what are the guidelines for schools about staff vaccinations, and then what commitments have we made as a district to staff vaccinations? So currently, the state of California does not require that a school staff member, whether it's a teacher or classified staff member, be vaccinated in order to return to in-person work with students. That is not a requirement that probably most employing agencies will sort of have for their own employees. And it's not a requirement that BUSD will impose on any of these partner agencies as they identify staff and train them and provide them to us. We have made a commitment to our own BUSD employees to make vaccines readily available. We were able to do that through a very effective partnership with the city of Berkeley. And the provision of those vaccination appointments is really concluded at this point. We've been able to offer an appointment to every single one of our roughly 1,600 employees who indicated that they wanted one. So I hope I'm answering your question sort of about vaccinations with agencies and then vaccinations with our staff. Great.
Okay, so what will this look like for special education services? In the next slide, we'll look at a few models of service provision for students who will be back on campus. In regards to specialized academic instruction or SAI, possible methods for delivering SAI will be push-in. That is teachers pushing in with additional PPE and appropriate distancing. And or pull out into an outside space, as Sean was referencing, or a different instructional space indoor, a separate space indoors. Or remote instruction. So even if a child is on campus, that child accessing their specialized academic instruction through remote learning via a laptop stationed in the room or perhaps outside of the room with an adult supporting. The other proposed option is specialist assigned work that will be focused on specific goal areas. Next slide.
Lena, can I ask, this is Eliza really quick, the previous slide, can I just ask really quick if you could clarify just what is specialist assigned work? Or are you talking about, for instance, speech therapy and so forth?
Yeah, I can add to that. I mean, what it really is it's asynchronous work, right? But asynchronous work that is really specifically designed for those students' goals. So it also may be, so that could be a speech therapist, it could be an OT, it could be our case manager that's providing that work. So we just want to make the distinction that it's not just homework per se, but it actually is designed specifically for their goals. Did that help?
Yes, sorry.
It was a good question. Thank you.
Our IAPPs continue to play an important role in our school reopening. In order to best meet the needs of our students while following safety guidelines, our IAPPs may be supporting through both in-person and virtual instruction. We have expanded our IAPP and behavior technician staffing to support delivery of services. We have also worked to ensure that our staff is given up-to-date training regarding health, hygiene, and positive behavior supports. Our related service providers will continue to provide services remotely to maintain stable cohorts, which in turn allows them to maximize their services. If an IEP team has determined that a student is unable to access these services remotely, we will look at in-person appointments. Services could occur in areas that meet safety guidelines, such as ventilated or outdoor spaces.
So as we said, and I know this was one of our most challenging planning sessions is how do we continue to serve our families in distance learning as well as have families come on campus. And so we have developed a plan that will be provide equal treatment to both of our programs to ensure that learning is still continuing and our families and our students feel connected with their communities. So families remaining in distance learning will be regrouped and assigned to a distance learning general education teacher. These are teachers that are very acquainted with distance learning. They are staying in distance learning for a variety of reasons, but they're very committed to this work and developing a child relationship with our students. We are going to prioritize keeping students from schools and classes together so we can keep that familiarity because we know that's extremely important. As a former principal, as a former teacher, like those bonds we know that children make with our adults are lifelong, right? I still have students from my third graders that still contact me and say hello. So we understand, and we also understand that it's hard to have this change. Our special ed, so another way we're gonna try to mitigate the anxiety of not being with our teacher that they were at the beginning of the year is that our special education teachers will remain as the service provider. And they will adapt the distance learning education plan as needed to help support this new teacher. And the sites also will maintain the same related service providers as well. So as far as the people that are serving your students for special education services, they will be maintain the same. Now, on the other hand, for their instructional aides, our paraprofessionals, it's a little bit different. And that's partly because we really need to maximize our services. And, I think it's a good reminder that even though we know that our students formed bonds also with our paraprofessionals, and we know that that's very important. We also need to understand that it is a service and it's not an individual. So at times you may have a couple of IAs, that paraprofessionals that are working with your student. And in this case, since we are being held to kind of stable cohorts, we may need to, and since we've hired additional people, we may need to have other instructional assistants supporting a student that has those minutes. And they may, in some cases, there may be a classroom where we may have a couple of students who need those services, and that adult or that instructional assistant will support both of those students. So there's a lot of variability around this. We want you to know that's why we did reach out to our non-public agencies to hire more, so that we can ensure that all of our students who have these services are able to receive them.
John, I might, if I can, just jump in. I do know that it's been sort of a source of anxiety for families who have selected to remain in distance learning. Who will be their teacher? I thought Berkeley side did a good job just yesterday in an article sort of, capturing some of the feelings, anxieties, worries of families who are sort of facing the creation of a new class list. I do want to assure everybody who's listening and reassure the Berkeley community that the teachers who will continue on in distance learning are BUSD teachers. These are experienced certificated staff who are coming straight from classrooms where they already have gained experience in distance learning through the course of the school year. One of the worries sort of perhaps amplified by the article was the use of substitute teachers in our distance learning program. And having just reviewed the staff list this morning, I want to offer the assurance that there are no substitute teachers working in our distance learning program. These are all BUSD certificated staff.
Next slide.
Okay, so as always, things are ever evolving in these pandemic times. So here are a couple of things to keep in mind, some situations that may trigger a switch to distance learning. Of course, as we learn more and as science conveys more information to us, these could change. If conditions change based on positive test results or other local conditions, in the event that a staff member is reported to be positive for COVID-19 and was in the cohort during their infectious period, the entire cohort will be quarantined, students and staff, and will participate in distance learning during the quarantine period. Individual school closures for 14 days in the case of an outbreak. An outbreak is specifically defined by the California Department of Public Health. And also in a school district, should 25% or more of its schools have to close for a 14-day period, return to distance learning may be considered. So these are all factors that will be ever evolving as we know more information, but they are key bullet points that we wanted to point out.
And Alyssa, I may offer just one sort of added perspective on this, that it will always be the case when the school district is contemplating any kind of quarantine situation that will make that case-by-case decision in collaboration with the local health jurisdiction. So that's the City of Berkeley Public Health Officer.
Thank you. Next slide. So regarding all of that content, we want to make sure that communication, as it has been, continues to be imperative in order for us to work together as a community supporting all of our learners. Some of the specific forms of communication that will be at the forefront during this time include student and families will be notified of a confirmed case if their student was on campus during the case's infectious period. If the case was in a cohort, the cohort will receive additional information based on the current guidelines. Staff will be notified and union leadership will be notified if there was potential exposure within 1 business day. And a note about confidentiality, that's such a theme in our world here. COVID response is confidential and it is consistent with privacy requirements. This means that there will be no disclosure of student or staff names or identifying information that will be shared with staff or families. And lastly, if all COVID-19 cases that are present on a school campus or district facility will be added to our COVID-19 case dashboard for the purposes of keeping that data and understanding trends and things that are going on. Next slide.
So this is just a reminder. Even though it's exciting that more vaccinations are happening, that we're schools are starting to reopen slowly, we also want to remind all of us that the pandemic is not over, and we really need each other to stay safe. So all students will expected to wear face coverings, unless, of course, it's waived due to their disability or health need. We'll have contact tracing, isolation, quarantine procedures. They'll be strictly enforced, which again could lead to some disruption for individual students' classes or even entire schools. We pray that that does not happen, but it is the reality of the situation we're in. And we have many safety measures in place. All families are expected to confirm that their children are free of COVID symptoms every day, and we'll have tables set up in the morning time where we'll be doing the attestation stations to make sure that that everyone is free of COVID symptoms. Students should remain at home if they are sick, of course. All visitors to school campuses and classrooms are prohibited except for a few limited volunteer roles. And substitute staffing will continue to be highly limited. We are working really hard to ensure that we have subs in place, especially if there's teachers that are going to remain in distance learning. We want to make sure that we have those subs at the sites to support as well. But again, we really need to continue to practice patience, kindness, cooperation with each other. We are all, I know we're all experiencing this in different ways. But this is also new to all of us, and we are working on this together. I think this is probably the most challenging situation we've ever dealt with in public education. And we are committed at BOSD to continue working with all of you, and we appreciate you. And in many ways, I think the relationships have strengthened with many of our families. I mean, that's, I think, one of the positive that's come out of this. Next slide. So with that, I mean, we really hope in the fall, you're praying all together that we, want to have our full day, 5-day a week coming back and get back to as much of normalcy as we can. We still will have some special arrangements for our families who request distance learning, but we are waiting for the time we can come back in school and we can all visit classrooms again and see and get back to a sense of normalcy, a different kind of normalcy, a normalcy that's better than what we had before. Next slide. And there's just some pictures of our community working together, emerging with our line of emerging stronger together. We have our nurses here. We have our laptops being delivered. We have different gear being handed out and supplies. So we really should be very proud of our community for all the hard work and cooperation that we've done. Next slide. And it's just a thank you again to just all the different folks that have been involved, from our staff to our labor partners. Of course, our teachers teaching from classrooms and home and trying to balance their own lives. Our families who have had to essentially become part-time teacher as well with their students' teachers and work together on it. And then our athletic conditioning staff, our tech workers, our fiscal services. There's so many, the list grows and grows and grows. So with that, this concludes our presentation portion. And now I know there's a lot of questions out there that we're going to be fielding for the next 6:40. So we have, I think we're going all the way to 8. Is that correct? We have a good amount of time together.
Yes, thank you, Sean. Thank you, everybody from the special ed department for a great presentation. I'm going to jump in with a question that was on the Q&A in regards to the transition. You mentioned a few times that this is like the beginning of the school year, and often in students' IEPs, students are able to go to campus prior to starting school to meet their teachers, see their classroom. And so in the event where there are students who might have new teachers or new service providers, new IAs that they're unfamiliar with, and the event that parents aren't really allowed on campus with their children that first day of school, can arrangements be made for students to have a meet and greet with any new staff or go to the campuses?
I might jump in on this one if that's okay, Sean. I'm going to answer this in two ways, like I did one of your previous questions. From a perspective of permissions, just public health speaking, yes, that's permissible. It's okay for a family to make an appointment with a service provider, a teacher, let's say, to come to campus and to just get acquainted, from a distance with a mask, those things. I also, though, want to say that there's going to be a large amount of work to take place in a very compacted period of time. These couple of days that staff will have next year are really for training, for getting sort of oriented to site-based practices, for room setup. And then as well for all of our special education providers, they'll be rewriting service schedules now to account for service provision in an in-person environment, as well as to keep track and support students on their caseload who are remaining in distance learning. So I can't promise that all special education teachers will be making these appointments, but from a permissions perspective, it is possible.
I'd like to ask a couple of questions from the families. So for the learning and emergency plan, can families expect service minutes to be increased compared to the DLEPs upon reopening and progressively during the current academic year?
Is that the end of your question, Eliza?
I guess that would be for you, Sean, yes.
Yeah, you muted for a second. I didn't know if you had finished. That's a great question. We expect that, yes, that would happen. We're in person, but again, due to the having to maintain the stable cohorts, it's still a bit of a challenge. But yes, we are hoping that that is the case, that we're able to increase those services through a different combination of push-in services, pulling groups out. Like I said, having maybe virtual learning happening, and maybe students on a computer with the teacher, the case manager on another part of the campus that's doing it, as well as also doing some asynchronous work that will be matched up with the goals that they need. So we do hope that that is the case, but we also know that every IEP is uniquely different, and different folks have different minutes, different students have different minutes. Many of our students are receiving their full services, and others we are continue to deliver in the greatest extent possible. But that is an intent. That's the intent of coming back to schools, that we can deliver more effective services. And even if it's not what's actually completely in it, at least by doing it in person, it'll be much more effective. So yes, again, we want, that's our goal to coming back to school, is to increase those services and to make sure our students are making progress on their goals.
So actually, this is a two-part question. So the other one is for Brent. Can you commit publicly here that IEP service minutes will be restored 100% during the current academic year, of course, barring any COVID restrictions from public health?
I appreciate the question, Eliza. It's difficult to make a commitment like that because we're still in a situation in which we haven't emerged from the pandemic fully. What we hope we're conveying right now is that our special education service providers, both case managers, all of our teachers, all of our related service providers, are rebuilding their schedules to support both students who will be on campus and who are remaining in distance learning. We don't yet know, because it hasn't been done, what those rebuilt schedules will look like. We're all assuming, just sort of based on the math, that there will be greater opportunity for service provision. But we haven't done this before. We haven't, as a district, served students in two different mediums in the way that we're about to embark on for these next 2 months. So I think that it would be premature to make a commitment that across the board there would be sort of that restoration. But just as Mr. Mansinger is saying, the goal is to get as close to the IEP goals and minutes as is possible under these circumstances. And I know every single one of our service providers is going to be working hard to do just that.
Okay, the second question is about assessment. Well, we received a lot of questions about initial triennial state district assessments, marking benchmarks for students, and how that relates to the next steps, which is learning recovery. So if you could discuss those two issues, those two.
Okay, well, our special education teachers and IEP teams are already assessing they normally assess our students' progress daily. So if they see a student struggling in a goal, they adapt their instruction. You can always reach out to your student's general education teacher and case manager if you have concerns about any of the progress on goals. We have been finding great success with our virtual evaluations. We have received a lot of great feedback from our families. Our special education teachers, school psychologists, speech and language therapists, occupational therapists, physical therapists, adaptive physical education folks, they meet weekly to discuss the process. They share tools to better determine if a student can be diagnosed under the Individual with Disabilities Education Act. There are 13 disability categories, as many of you know. Learning loss for all of our students has posed a huge challenge to all districts in determining if a student has a true disability or if it's really a lack of instruction. Our federal and state regulations really make it clear that a child should not be determined to have a disability if it is just a lack of appropriate instruction. So that's what makes this time really, really challenging. Because the lack of learning that's happened across the board for many students, starting back in March. If right now we're currently using in BUSD, it's a patterns of strength and weakness model to determine if a student falls under a disability category. And this is opposed to kind of the old school discrepancy model, which basically tells if a student is performing more poorly than expected, while our patterns of strengths and weakness really determines why a student is is performing more poorly. So it really is looking at the whole child. And that's the thing I'm most excited about with our assessments that we've been doing, is that we've really taken a different, we were doing it before, but we've really, really looked more deeply and planned more deeply about how do we look at the whole child. So we look at pre-pandemic data, we look at current data, we do interviews with our former and current teachers, with our families, with our students. We have them complete tasks that we can observe. So again, we're trying to get a full picture of the journey that this child went before they were being assessed. Moving forward, we are transitioning to more of a hybrid approach, we hope. We're going to continue with virtual with some. It really is dependent on the student. Some students it's been very successful, and others we know that there may need to be some in-person portions of our assessments. We've completed 80 of our initials and 120 triennials this year. I know for a fact, talking to other districts, like other districts haven't even done any initials. So we've really made a lot of headway. We are looking at this summer and trying to see if we can get additional staffing to and use our own staffing to complete initials and tries that we're behind on. But this is a common issue across all districts. I'm very proud of our teams for the work that they have done. And if you feel like your assessment is behind, it hasn't been done yet, you can always contact your site, your case manager, then your principal, and ask the progress on it. And if you don't get a response, you can always reach out to myself or our supervisors to ensure that we can support with that process.
Thank you, Sean. I'd like to go ahead and go to a live question from our audience, and
Okay.
I'd like to call on Tanisa Santiago.
Hi.
Hey, Tanisa.
How's everybody doing tonight? I am calling in both as a parent of two Malcolm X students, one who has an IEP, as well as just a member of the broader community. One question that I think is on a lot of the community's minds that I was hoping would be covered last night, but wasn't with specificity was, are teachers being afforded the same opportunity to choose what is right for them the way that families are? And I say teachers, but I mean all faculty and all staff. Are they being offered the choice about whether returning in person or staying distanced is right for them?
Thank you for that question. I can help unpack the process that the district has been using in order to work with teachers on an individual basis. So very early in the pandemic, as we began to sort of contemplate a return from distance learning to an on-campus environment, we made a commitment to comply with the Americans with Disabilities Act and its sort of individual process. That accommodations process allows any employee to come forward on the basis of an underlying health risk and seek a number of forms of accommodation through what's called the interactive process. The interactive process is by definition individualized. It's meant to account for the specific circumstances of an employee. And we went even further to account for the individual family circumstances of employees for folks who are in caregiving situations or who may live with at-risk individuals as well. Several months ago, we went through an initial round of those accommodations meetings. That process continues. And then about 6 weeks ago, 4 weeks ago, I'm sorry about my timing, we were able to begin a vaccination program for all of our staff. And the point of the vaccinations, of course, is to eliminate the sort of risk or to minimize the risk to individual employees that may stem from COVID-19. So we continue to work through the accommodations process and work with individual employees. And that is essentially the process the district has used to support employees either to remain in distance learning through an accommodation or to return to work. Separate from that, there's been a second process by which individual employees could apply for one of the positions in the distance learning program. We did have a number of elementary staff apply through that process to remain in distance learning. And it's in fact that process that is leading to the sort of selection and assignment of our distance learning teachers. So it's through those two methods, one, the individualized accommodation practices, and then the other, an opt-in distance learning application that is available to elementary teachers, that we've tried to support all of our teachers to find the right assignment for them for the remaining 2 months of the school year.
I'm going to read something from the Q&A. Oh, sorry, Sean, you're going to say something?
Eliza, I just wanted to note too, if there's any follow-up questions or for any of these that if there's some unclearness and anybody wants to follow up, I invite that as well.
Great. So I'm going to read from the Q&A forum. Education Advocate says, and will extended school year be expanded and individualized to help prepare students for next fall and address regression?
In addition, there's another question on the Q&A regarding medically fragile students who would normally qualify for ESY, but cannot do it in person. And right now there's only an in-person option. So if you could address both of those.
Thank you. So yes, we are in planning right now for our extended school year. We are looking to strengthen it, make it better than ever in order to ensure that our students are making up some of that learning loss. We are looking at doing both models. One of our big concerns is just, teachers it's been a tough year, and we're really right now recruiting and for teachers for ESY, and we do have we've had some pretty good participation. So we are in process of that, and certainly we'll look at both models because we do know that there are some students that may be medically fragile, that there is still a lot of apprehension of coming back. So absolutely.
And then let's take another live question from Lily Howell.
Hi, Lily.
Hello, can you guys hear me? I'm on new headphones. Yay, they work.
Yeah.
Okay, cool. I just wanted to check in. So this presentation so far has been very informative, but very elementary school focused. And I'm wondering about our mod severe students in the middle schools in particular, since there seems to be things going on for high school students and now there's things emerging for elementary. If there's the possibility for some sort of cohort model for mod severe middle school students to return to campus in some sort of bubble to get in-person services that they have been lacking. I would hate for our commitment to full inclusion be the the barrier for our kids to access services. And so I'm hoping that there's something in the works, or there's flexibility for school sites to plan for those Montsevier students in middle school.
That is definitely something that we've discussed and that we're very interested in. I think it's important to understand we are still in negotiations with our labor partners around opening up for middle and high school and elementary too. But it's definitely something that we've looked at and we've thought about. We do want to maintain our, we're one of the few districts in California that have really adopted an all-inclusion model. So we know that there are very many opinions on that. But we know that there's some fundamental services that our mod severe and many of our mild mod students that they really need. So it is in planning. I don't think we can promise that right now per se, but it's something that we're definitely looking into. And Lena, I don't know if you want to add anything. If there's any additional, you don't need to, but if you have any further.
No, just that I hear and respect. I think it's a great question, and I appreciate it, Lily. And it is something definitely that we've discussed and we are working on. So thanks for asking that question.
And if I can add, like we did do some pretty intensive planning around trying to open up some ed hubs for some of our students, and just to be transparent, one of the struggles we had was finding enough non-public agency folks to be able to support that process. And now that we've started to moving to school reopening, we've put more of our efforts into that. So definitely that's something we want. We want to get our students back to class so we can give them that in-person support that they need.
I guess the only other thing I wanted to add was that it's not right now for our kind of spring sprint, but in terms of ESY, Lily, looking at that as a time that we'll have a concentrated group of our mod severe kids together to work on specific needs for those individual kids and that group.
Yeah.
Sean, I have a question. I don't know if maybe Superintendent Stevens can answer, but as we get closer to reopening dates for middle and high school and more information becomes available, do you think that we could get that information out to the families for the older students that are here that want to hear those details?
Yes, absolutely. Sorry about that delay. Yeah, as Sean Mansinger mentioned, we are, I think, about a week away from being able to share news both about middle school and I suspect about high school as well, sort of exactly what the return model will look like. And as soon as we tack down the sort of basic details of the model for middle and high school, it allows a lot of other planning elements to fall into place. That was the case with our elementary planning, and I think it will be the case with middle and high school as well. So the community should be on the lookout for more information from us. And I imagine that we'll be hosting another sort of series of town hall convenings designed for middle and high school families to be able to understand the model and ask lots of questions.
Okay, so I guess I'm going to read this question about the transition program. Jessica Badler. There are in-person plans happening for all BUSD students except those attending the transition program. It is understandable that ACAT does not want to start bringing out students out in the community every day at this point, but that doesn't mean that these students should be left behind. Could a space be arranged, maybe at the adult school, for these students to attend a more sheltered program for the time?
You're on mute, Eliza.
Oh, did you not hear my question?
That was the end of the question.
I think she was done with the question. She's really fast on that at the end. Eileen, do you want to tackle this one?
I can talk about it a little bit.
Please.
Yeah, I mean, as some people may know, we do work with Ala Costa Adult Transition for our 18 to 22 program for students with moderate to severe disabilities, and they are still working on their plans, and they don't have any tentative reopen dates for in-person instruction at this time. That being said, I think this is a great question and a conversation to bring back to the providers and the case manager working with that group of students to consider some options. I don't know what that could look like or have really any concrete answers, but I do really appreciate this question. And I think this will be a great opportunity for some discussion and some idea forming.
Yeah, what we can promise is that we will actually reach out to Ella Costa and we'll start having this conversation.
Great, and I'm going to go ahead and do another question from the Q&A. This is from Lisa H. My child is in distance learning. He participates in a math intervention group and a speech group currently. Will these continue? If the other students are in groups on campus, will my son be zoomed into the group or will the groups be reshuffled? And this, I think, also is in conjunction with several of the questions that we saw on the thought exchange in regards to hybrid services for some of our special need students who may be getting part of their academics perhaps in distance learning, but getting minutes in person with an OT or speech therapy, or vice versa, having opportunities for social interaction with on-campus students. So can you address those issues?
These, just so I understand the question, these are students that are staying in distance learning and how they can be connected with their peers at the schools. Is that correct?
Correct. And like the students or teachers that they may have had bonds with, their small learning groups like math interventions, their speech groups.
John, I may jump in on that question, and then we can talk a little bit about what I imagine is going to be an awful lot of creative instructional methodology that we're going to start to see in our schools. Distance learning families should know that we are not reorganizing case managers' caseloads. We're also not planning to reorganize math intervention services or literacy intervention services. So if you're receiving services from a literacy coach or an RTI teacher, from your child's school, all of those services will remain intact. They may need to be rescheduled given that they are being asked, these service providers are being asked now to work in two different environments, a remote environment and an in-person environment. And I imagine that they're going to have work to do next week during these transition days to make sense of sort of where the students are on their caseload, where they are physically and where they're available during the day. But please know that those sort of service lists for all of our service providers have not been reorganized. Students' caseload, or sorry, teachers' caseloads will remain the same. And then in terms of sort of instructional methods, I have a feeling that we're about to see an awful lot of creative teaching. I know that we've seen a lot of it over the last 10 months or so. And now as our teachers are on campus for the most part, working both in person and working remotely, I could imagine some of the methods, in fact, some of the ones that you just mentioned, Vicky, even sort of beaming kids in to live in-person school, in-school instruction from their homes. So I don't know exactly what this will look like, except that we're going to support everybody to think creatively and to maximize the opportunities for students both to build those connections and have access to teachers.
Okay, so thanks for that answer. This is Carrie Rosenbaum. Just to jump in, I think that might be one point that we'll ask for some follow-up on, since it sounds like there isn't really an answer. So just to flag that for everyone.
Yeah, we'd be happy to report back. And I'm not at all trying to hedge. Each of our individual sort of service providers, our teachers, will have to go through this highly individualized sort of scheduling process next week. And I just have seen so much creativity over the last 10 months. I expect there will be more, and that we'll probably be seeing sort of a whole variety of options offered to both in-person families and distance learning families about how to provide these services.
Okay, thanks. I think one of the key parts of that question was, will children who are in existing groups for services get to remain in those groups, or will they be with new and different children? If I understood the question correctly.
Yeah, and I think that's where I don't know that I could provide the universal answer yet, given that each teacher's scheduling will have to be so individualized.
Our goal is to keep it as consistent as possible, but we also want to make sure we're maximizing services to everyone, and but we'll definitely get back to you with that progress.
So I'm reading a lot of questions here in the Q&A forum about learning loss. They're still continuing questions. Sean, I'm wondering if you can direct more specifically answers to the kinds of learning loss programs that will be implemented, not just for in-person, but also for distance learning. And one of the questions is how will students, related to learning loss, how will students' IEPs be changed to account for how their needs have changed during the pandemic?
Yeah.
Can I jump in on this one again? I don't mean to scoop on something.
No, please.
Feels most fair to talk about what the district is doing. So first, as we think about learning loss and really sort of supporting all of our students in the transition from their homes back onto campus, not only this spring, but over the summer, and in fact, through the duration of the 21-22 school year. This is first and foremost a district effort. It's a general education effort. And as we build programs that will serve all of our students, we're keeping in mind that those programs can and should include students with disabilities. So as a district, we're engaged right now in both expanding mentoring opportunities during the springtime. We're offering a new science program called STEM Steps through a local educational organization that begins this spring. And then we're looking at a sort of dramatically expanded set of summer learning and enrichment opportunities that are both academic in nature, but we also are, wanting students to have social sort of enrichment as well. So we know at this point, as of sort of mid-March, that will include a dramatically expanded STEM Steps program, a partnership with Camp Edmo, another science-oriented program. We're in conversations with Lawrence Hall of Science about expanding their programming. We believe that we'll have an additional tutoring partner online by the time we get to the summer. And then we're also in contact with local camps, both City of Berkeley camps and other private providers, to find ways to sort of move our BUSD students who appear to be in need of that kind of enrichment into camp programs that they might not otherwise access. So in effect, what we're trying to do is identify all students, those with disabilities included, who are in need, and matching them to a sort of dramatically expanded set of opportunities. And then in addition, we're also looking at a more specific program that is sort of tailored to the needs of students with IEPs. And it's at that point that I'll, in the context of a larger body of district programming, I'll turn it over to Sean to talk more about the sort of smaller set of special education programs that are right now in design.
Yeah, thank you, Brent. So yeah, I mean, as far as for recovery, we are we have our ESY program that we're strengthening. But then we're also looking at additional, like a math or reading type workshop model for the summer that select groups would participate in. We're looking at our own staff and recruiting our own staff for that. Staff that have been trained in Wilson or Slingerland for dyslexia. And we're also looking at hopefully working with some tutoring agencies to also provide that support as well. And then again, we want to really just highlight that any of these programs during the summer are for all of our students, whether they have an IEP or not, because a student with an IEP is always a general education student first. I think Go ahead.
Sean?
Oh, no, go if you, did you want me to expand?
Well, I'm hearing a lot of, and it makes sense to talk about general education learning loss as well, but folks should know that there are upcoming funds that are targeted for high need students, including students with disabilities. So I think we want to hear more about special education recovery here, learning recovery here, if you could.
Well, I mean, I think the first and foremost thing we want to do is we want to ensure that this instruction that we're delivering is effective, right? So that'll be the most important piece of it, is making sure that we're training our teachers, not only our case managers, our special ed teachers, but also our general education teachers, and universal design for learning. Making sure that our classrooms feel safe for everyone, that there's multiple ways of participation in these classrooms. And then we want to make sure that, that our actual, our pull out or push in instruction for our SII minutes are also effective. So, right now we've done a lot of work on training our staff on Wilson. We have up to 40 to 50 people that are trained in that area. They're going to be able to deliver more effective dyslexia intervention to our students. We're also looking at expanding and growing our math intervention as we come into the new year as well. So those are just a few ways. And then, of course, we are looking at different opportunities. There may be tutoring opportunities where we can utilize our own staff that could do work after school to help support students, as well as working maybe with tutoring agencies. It's a hot topic right now. I feel like at least twice a week I'm in a forum discussing this exact topic, whether it's called learning loss, learning recovery, learning mitigation. It is something that we're all struggling with and planning around, and we will definitely, as we progress through the rest of this year, we'll be putting more plans in place.
And then Sean, just what's the timeline for that menu of options?
I mean, we hope this summer we're off for some of it, but then as we move into the new year, we hope that those things will be offered.
But for families to sign up or families to be notified what's available to their children, roughly.
Well, ESY, we've already put applications out for that, but as far as the other areas, we expect probably in the next few weeks to be able to start putting that out.
Great. We're going to go to a few more live questions. We're going to start with Sarah Boyles, and then after that will be Michelle Burns. Go ahead, Sarah.
Sure. So, I mean, for a lot of our kids, this is going to be one of the biggest transitions ever. So we're wondering, what plan do you have for mental and behavioral health adjustments for kids? And what kind of funding, like external funding, is available to facilitate equitable mental health and behavioral health support across all of the school sites? Because I know there are variations currently with the services that are available for mental health.
Yeah, I think probably I'll answer this question, and it might be a two-part question, sort of what services are generally available to all students at our schools, and then particular augmented services as they're offered through special education. So all of I'm going to focus on elementary schools, but this will also be true of middle and high schools. All of our schools do have contracts with mental health providers. That means that there's counseling opportunities available for students either on a short-term basis or sometimes on a long-term basis. And those counselors are also connected into our Department of Student Services, which itself is connected into city services and a variety of private providers that we can use to connect with families in the event that there's particular difficulty associated with this transition, or whether there are just difficulties going on in general. Also, more generally speaking, our principals have been going through trainings that will then be translated to teachers that have essentially encouraged all of our schools to adopt a trauma-informed approach to this transition. And by that, I mean to really refocus on rebuilding community for kids who are coming onto campus, to have opportunities to discuss their experiences and feelings about coming on, and then to equip teachers with a lot of sort of teaching prompts to be able to facilitate conversations about what this transition is like. So those are just a limited number of what I imagine are going to be multiple strategies taking place at the school to address what will be a very large transition. And then within special education, I know that there's also particular services available. These would be much more individualized, sort of on the basis of a particular student's needs. And Sean, maybe I could turn over to you or members of your team to talk about what a special education family might do with his or her counselor in the event that something was starting to happen in this next period of time that was impacting learning.
Yeah, and anytime where you feel like a child with an IEP is experiencing some kind of a emotional trauma or struggle, it's really important to reach out immediately to the team. We do have something called ERMS, or educationally related mental health services, and that can be, it's one-to-one type of services. Sometimes there's also counseling provided to parents in those areas. So that is something that to reach out to IEP teams. It's an IEP team decision for that, but it is an area that that families can access. And again, we also want to make sure that we're always focusing on our students with IEPs as general education students first. So they should be able to access all the regular services at a site as well. I will say that earlier today I was in a meeting with our student services director, Dr. Shelley, and with Berkeley Health to discuss this topic and see about expanding services next year. All of our sites currently have counselors now to help support. At the high school level, we have our Berkeley Health Center that students can always access. So there's always those supports there. But I think it's really important to note that you should always be reaching out to your case manager if you start to see that there's a struggle with your student. I also say there's also power in one of the things as a former principal is we had mentors. All of our teachers used to mentor our students. So when we saw that a student was really having trouble, like we would basically use a village approach with that student and making sure that we all were aware of what was going on. So I know that's something that our school sites really work really hard on to help support our students. And Alyssa, would you like to
Can I
jump
just
in?
add one thing, Sarah? Do you mind?
Yes.
Just, as the person who supervises the instructional assistants at Berkeley High School, today we had a great meeting where we invited one of our district behavior analysts, and we're, preemptive in preparing because we don't have all of the details yet, but in talking about what can we do right now today to prepare for the possibility of return to in school. And there's little things that we're doing and that we're conversing about, like starting to wear masks on Zoom so students know what a teacher or a provider is going to look like with a mask on. So I think in the staff preparing for students' reaction to the changes and possible challenges, it's having those close collaboration and those opportunities for staff to work across disciplines and talk about what's working and what are we doing. And I know there are a lot more opportunities that are planned, but there's opportunities like today where we just had the opportunity to have a discussion about what are some things we can start doing right now, not knowing a timeline set in stone. So.
Sure. I mean, just specific to special education, I'm just wondering if, the general classroom teacher, whether there's been collaboration about, dealing with likely maladaptive behaviors, like an increase in elopement, sensory overload, because kids haven't been in larger groups for a year. And if there's going to be room to be flexible as kids readjust behaviorally to this kind of environment. And, the idea that they are going to wear a mask for 5 hours.
No, absolutely. Our student services team worked really closely with our behaviorists on the SPED side of the house to develop a curriculum for all of our staff coming back. And some of that's like facilitating classroom discussions around issues from the pandemic, being open to feelings and uncertainty and allowing opportunities for our students to explore their feelings and to express them. Just providing opportunities for children to reconnect to the actual environment that they're in, to walk around, to do tours of the campus, to discuss different situations on the campus that they may run into. And we really want to help our students kind of shift from a stressful memory into more of an awareness of kind of coping and learning coping strategies. So yes, and for me, like this is exactly why I became a special education director. I mean, I could have stayed on the general ed side of the house, but I really started understanding that every one of our teachers should be serving our students. And I think what happens sometimes is that people look at the case manager, special education teacher as the primary teacher, and in fact, it's not true. Like the primary instruction really is coming from especially in an all-inclusive model, is really coming from our gen ed teacher. And it's really important that there is a strong relationship that's happening between all of our related service providers, our special education teacher, and our families to surround themselves around all of our children, ensure that they're getting their emotional needs met and their academic needs. So our teams are working really hard in this preparation of coming back. Our principals are prepared. We have a variety of lessons. We'll be going back to using almost back to like, I don't want to say back to the basics, because sometimes those basics weren't so effective for all of our children, but we're really enhancing and making sure that when we come back, that emotional support and uncovering feelings and is really a priority. The academics, of course, are also a priority, but this coming backstage, we really want to provide a space for our children to be able to reconnect with each other and reconnect with the important adults in their lives.
Great, thank you so much. We're going to go with another live question, and that's coming from Michelle Burns, one of our attendees.
Hi, Michelle.
Hi, thank you very much. I first want to just say thank you for having this town hall with this specific focus. I have 2 kids in Berkeley Public Schools, one of whom has an IEP and has underlying medical conditions, which means he will be continuing with distance learning. And that in and of itself was a heartbreaking decision, because he would love nothing more than to be back with his community. And he has an amazing team at Emerson, from the principal to his teacher to his special education team. And throughout, I've participated in a number of these town halls and really tried to stay informed. And what I'm really concerned about is that there's so much emphasis on the experience for kids who are going to be going back into the classroom, that I feel great concern about the kids who are unable to return to the classroom. And it feels like they are being, for lack of a better word, punished for their inability to go back. And I understand it's being framed as a choice, but in our case, it's not a choice because due to medical issues. And so when we're talking about reintegrating kids and making sure that they feel reconnected to their community, supporting their social and emotional learning, again, I'm wondering how that's going to happen for kids who are not able to re-engage with their classmates, who will be put into a classroom in many cases with a different teacher, with the vast majority of kids that they've never met. And my last point would just be about the discussion about the transition period. And I just want to express some frustration that we are having this transition period, not frustration with any of the teachers or staff, because of course they need that time, but the fact that the emphasis was so much placed on returning to being in person, that everyone is necessarily being affected by loss of learning as a result.
Ms. Burns, thanks very much for the comments. I take it to heart, everything that you're saying, and we're hearing the same kinds of sort of comments, really kind of like laments from families about what's going on with the loss of a teacher. I do want to communicate that this was, I think, among all of the difficult decisions that we've been faced with as a community over the last year, among the most difficult for the Board of Education and for me to contemplate, having to remake class lists, 3/4 of the way through the year. Doing so has enabled us, I think, to make upgrades to both distance learning and to create an in-person learning experience that we recognize so many families need for a variety of reasons. But I just want to sort of acknowledge and honor that you've brought these concerns forward. I do hope that you will be seeing from your school, and we are organizing lots of different ways that school communities will continue to reach out to families who remain in distance learning. I would expect to be hearing from your principal still. I would expect check-ins. I imagine you're going to be hearing from your regular teacher, in addition to your new distance learning teacher. All of these things, I think, that they will be demonstrations of heart by every one of our school communities towards families who must, for a variety of reasons, stay in distance learning. So thank you for sharing the perspective. I really do take it to heart. I'm going to begin working more on this tomorrow, but I do know that these conversations are taking place now.
Just to follow up on that, if I may, real quick. Thanks for sharing that information. Are there formal plans? Will there be any kind of requirements for teachers to meet with the students that are staying remote? Because as of now, it sounds mostly like the connection will be newsletters and really good intentions, but what sorts of commitments and tangible stuff can you offer as far as maintaining the social, emotional, and even some maybe quasi-academic connection to their teachers and classmates?
Yeah, I appreciate that question, Carrie. I don't know what each school will sort of envision by way of making connections. At the district level, we haven't sort of thought of this as a uniform way to try and stay connected. What we have done is as we're reassigning teachers to distance learning, and I'm going to remind everybody, these are our BUSD teachers who will continue on in distance learning, who have experience in their grade level curriculum, who have been teaching remotely for the year, and who have shown, caring for their current class and will show caring for their new class. I know that school communities are going to, sort of wrap themselves up in this challenge of keeping their community intact now that students are learning in different ways. As a district, we haven't defined what that's looking like. I'm not in a position to sort of offer you any kind of commitment across every one of our roughly 450 elementary classrooms. But I do know that there's lots of talk going on already about what this can look like.
Okay. Well, if it could be considered to ask teachers, I don't know if this would violate contracts or agreements, but to have like a weekly meeting with the students that are remote, is that something that you could ask them for? And is that a possibility? I think, I know that you've emphasized that the teachers that will be stepping in are BUSD teachers, but they're not the teachers these kids have had all year. And especially for SPED kids, that can be a real issue. So is that something that you can ask the teachers to do, have like a weekly Zoom meeting with kids that are distant?
Yeah, I can do that, and I can sort of encourage lots of other thinking as well, Carrie. Again, I can't make a commitment tonight about what it will look like in every school and every classroom, but it's something that I'm concerned about, and I appreciate that it's raised tonight.
So a few follow-up questions in regards to this sort of trauma-informed approach. Students both in distance learning who are losing their teachers are going to potentially have trauma, as well as students who are going to be back on campus and have different expectations of them. And so similar to when we first went to distance last March, there was a shift in, and we have a question on the Q&A about minimizing homework or moving to pass fail. So in addition to those kinds of stress reducers for students who are going to have to be acquainted with possibly new teachers or new classmates or new locations, also, as students potentially have outbursts, I guess parents want to have some reassurance that those are not going to be treated as behavioral issues, but as trauma responses. So we just want, that clearly stated.
Yeah, thanks, Vicky, for that. That I'm going to just sort of refer back to the training that I myself was part of just a week ago with all of our principals. That particular discussion, which was led by our own restorative practices coach, was really helping principals sort of contextualize students' return, helping them think about what the variety of behaviors that they may witness could mean, and ways in which to sort of gradually build up expectations, and to avoid what I think would be a mistake of just, converting to in-person learning. And imagining just that the curriculum can continue on with its same march, that homework would continue to be assigned, but rather that there would be ample opportunity for teachers to explore with students what this meant to them, and to help communities sort of rebuild and in effect heal from the experience that they've just gone through.
Great,
I'm going to ask a question. I'm reading a lot of questions in the Q&A about assessment, and there's more kind of asked for more specificity. I'm going to try to combine this two different questions, and they both have to do with assessments. If a triennial is overdue and families no longer want to wait for the assessments to be completed, will you be willing to fund independent educational evaluations? And this other one also has to do with assessment. Families are wondering, and there's a concern about combining this kind of learning loss approach with GE. for SPED families. Families are wondering about, what they're wondering about is progress toward goals in particular, which is a different way to measure. And so how will you gather parent input about how much support they've provided and what they've seen in terms of behavioral, functional, or academic challenges? So it's about assessment.
So the first part around the IEEs, once a district does its own evaluation, any parent has the right to ask for an IEE. And then, as a district, we have to choose if we're going to honor that or not. So that's really an individual decision for a parent to make, and is based on, student need.
So to clarify, does that mean that no, a parent cannot get an IEE that the district would honor if they're waiting for the district to do an assessment and that the assessment is delayed?
I can't answer that question right now because it's an individual choice for
Okay.
each IEP team.
Okay.
And the second part of the question was around progress of goals, right? It's important to remember that a family, the parent is part of the IEP team. So yes, like they're part of that conversation. They should always be part of that conversation. Progress and goals is probably one of the more contentious parts of an IEP because it's subjective in many ways, right? Some people say, well, we've made progress, and others say, well, it's not enough. But it really is an individual decision from the IEP team to make that. And I also say that we have been making many efforts with contract agencies to catch up on our triennials. There's a lot of work that we've been doing with our own teams to be creative and be solution oriented around that. So I would say that if you feel like, check in with your IEP team to see where the progress is on that. We are hoping to catch up this summer with many of our assessments. And in some ways too, we can do, the nice thing about a try is that a student already has some of the services, and we can look at those goals and focus on those goals a little bit more and make sure that we're adapting those goals to meet the student needs.
I think a follow-up about that is how will the district be informing families about their right to receive compensatory education, regarding learning loss? I know we're on these DIEPs, but does that mean these minutes that were lost are gone, or will there be compensatory minutes to sort of make up for that loss of the IEPs this past year?
Yeah, those determinations, they're really on an individual basis. They're going to require, they're really going to require time back in person in order to assess the current levels of performance and progress. The federal and state guidance intends for determinations to be made after return to regular instruction. And we're not quite there yet. We're getting closer. We're really working out those logistics to address each child's needs in their individual context. The directors and our SELPA, we've all been working and talking about these conversations. But really, ultimately, it really is it's an individual decision from the IEP team.
And do you know what percentage roughly of the families with IEPs have chosen distance learning versus in-person learning?
I don't have that off the top of my head, but because we're still kind of working on that data, but that's a great question.
Okay, thank you. We're going to go with another live question. We have Andrea.
Oh, hi, thank you. I just wanted to follow up on the questions about assessment. I'm sorry, I'm a Oxford parent. And maybe I missed this, but at what point will the district begin doing in-person assessments? Because I believe that question about IEEs probably pertain to in-person assessment. Is there a timeline for when the district will begin doing that? Since we are, the staff, providers, and teachers are doing in-person instruction now and service provision. So when is there a timeline for that? And also, will certain groups or what will be the priorities within once in person it begins? Thank you.
Yeah, well, I think it is important to recognize that we still are in negotiations with our labor partners. So, those determinations will be made later. But we are in the process right now of planning with our school psychologists and our speech and language therapists, our occupational therapists, our physical therapists. We are in planning a process for our virtual assessments. Which basically would be, there are certain components that could still be done virtually, and there may be some that are done in person. And again, this really is based on individual need for each of the students. So, we believe that our virtual assessments are effective and working. And we also know that for some of our students, we do need some few in-person components. And in fact, we have had folks that have been doing some in-person components, but that's really on a voluntary basis at this time. But we are in the planning of making sure that we have safe environments to be able to do some in-person as well as we move forward. And we're really hoping certainly in the fall that we would be back to doing mostly in person. But again, there's many aspects that, a big learning process. I think the most important thing to remember about assessments is all these were really based on very standardized approaches and in a very comparative way. And this whole process of COVID has really kind of thrown us all for a loop. So that's partly why there was a gap in doing our assessments, is that nobody really knew how to do it. And even all these folks that are doing private, they also have caveats in all of their reports that name that COVID has really kind of created some conditions that are making it a little more challenging to determine. So again, I just want to go back that I'm very proud of our team. They've really created a process that's looking at the whole child. And I think it's really increased relationships between families. It's increased relationships between our service delivery teams. And, we definitely want to get back to that in person, because having that connection with the person across the way is really important. But I sat in and observed an assessment last week, and I was very impressed with the amount of information that can be drawn between the school psychologist and the student in that process. But again, we'd like to get back in person as soon as possible, and we are in that transition period right now and doing some heavy planning on that.
Thank you. So just to recap, what I heard is that there are still sort of some labor and union agreements to work out so that staff are protected, that in some instances, depending on the individual needs of the student, that in-person assessment may be done starting now, and also that your timeline for going back to in-person assessment is the fall. Is that correct?
Well, we hope sooner, but I think we're just we are tiptoeing into this now and trying to be as cautious as possible. But we hope again, like in fall, that we're back to. But we don't know when. We don't know if the pandemic, if we could see spikes in it. The nice thing is that we've created a structure where we can still continue on and doing our initials and triennials now, and that we can limit as much as possible the in-person unless it's really needed.
So I'd like to ask a question from the Q&A forum, but before I do, I just want to respond to Sean, what you were talking about, measuring IEP goals progress. I just really want to stress that this kind of metaphor of, we lift all the boats in terms of learning loss, then everyone will benefit. I think that there needs to be a targeted approach to addressing learning loss and measuring that for our students with disabilities. And there is funding, like I said, for us to do that. And I'm going to bring this up as an action item. Hopefully we can have a follow-up to how parents can be involved, families can be involved on how funds will be allocated to address that specifically for students with disabilities. So this question is an assessment question. It's a child finding question. Kennedy Bierman asks, when will students who came in this past year and hence were unable to qualify for 504 or IEP plans be able to qualify And will this be done remotely or in person?
Well, I mean, that's a great question. I think if they feel that their student has a learning disability, they have every right to ask for that assessment from the school site teams, and then we would begin that assessment, and we would go through the process to determine if it truly is a learning disability, and the same for Section 504. Like you would ask for that assessment, check in with the school site team.
So
I
Sean,
think
just to,
I think I
sorry,
understand that question, if I'm understanding the question correctly.
you are understanding that question, but I think there's something that there's a misconnect here. We're hearing from several families that there are delays in assessments. There's families who are coming in asking for initial assessments, have not gotten their initial assessments. We have questions regarding parents who want to know if they'll get comp ed for delayed assessments for new students getting services. And so your indication to us is that assessments are not delayed, but that's not what we're hearing from parents. And so perhaps that's not trickling up to you. So if parents feel that their assessments are being delayed or not adequately met, or that they're new students and they're not getting initials and their school site is not responding, can you explain what their recourse would be so that the district's commitment to actually completing these would be done?
Well, first, I just want to, I don't believe I said that I didn't feel like that all assessments were on time. Like all of our assessments are not on time. I mean, I don't believe there's a district out there that has all their assessments on time. What I will say is that we've done a lot of chipping away, and I think we've made a lot of progress. And we certainly are still behind the timeline for many of ours. And that's why we said we want to make sure that we're tackling some of these over the summer. We did put some priorities on a lot of our initials. I think what's happened though is that we've seen an influx of families asking for initials, and that might be partly due because they maybe truly suspect a disability, and it might partly be because there's been a lot of learning loss that's occurred, and it's our responsibility as a district to determine if it truly is a learning disability or if it's because of not having academic or having the academic support that they need in the classroom due to learning loss across the district. So if there's two kind of prongs to determining if a student has services. First is do they qualify under one of the 13 categories of individual disabilities with Education Act, and the second prong is will they actually benefit from the services. And so it's challenging to determine that, and especially in our current environment where we've had loss across the board for everyone. So if it's determined that a student qualifies later on, the child finds an always issue. But again, that is a individual determination that's made at each IEP level. And if there is a determination that there's some compensatory that is owed, then that would be through that process, to the IEP process.
Thank you. I appreciate that. I'm going to go ahead and
go
ahead, Brent. Yeah.
Just more directly answer your question. So if a family is experiencing an issue with 504 assessments and not finding that the school is responsive, the administrator in Berkeley in charge of the 504 program is Dr. Philip Shelley. He's the director of student services with the district, and a family should reach out to him if they're finding that there's an issue at the school.
Thank you. I appreciate that.
Yeah, and I'll say the same for myself as well. If you feel that if a family feels they're not getting response, then they can reach out to myself, the supervisor. It's always good to go to the principal and the case manager first, but if you need support, you can always reach out to me.
Thank you. I'm going to go to another live question. We have Education Advocate, PTI.
Thanks, you guys. I am using my work account, so I'm sorry my name isn't up there. This is Cheryl Thies. I'm one of the 4 education advocates at DREDF, which is the Parent Training and Information Center. And let me just say how much I appreciate all of the special ed staff. It's been quite a year, and I know everybody is burning the candle at both ends. My question is really more of an equity question. And I say that because we serve 30 counties in California, and I talk to a lot of families, and this is a consistent issue I'm hearing. And I don't want to make it sound like it's unique to Berkeley, because it's not, but it is a big problem, which is that services like extended school year, which, for example, might not have been in a student's IEP before, but that student might now need it because of regression in learning loss. Not all families know to ask for it. They don't all know to ask for an IEP meeting. If you aren't reaching out to let them know, by the way, if you think your student has had learning loss, you have the right to call an IEP meeting, and we should talk about things like ESY. And we're running out of time, right? Because the year is winding up. And another similar equity issue is around mental health. So we're getting a ton of calls from families whose kids have had mental health crises over the last year. Some of them, the families are a little embarrassed, or maybe that's not the right word, but they're worried about privacy, so they haven't necessarily shared that. And we're always encouraging them to let the team know, because as Sean and Brent both said, that this is urgent. But I think if you don't reach out directly to do some kind of questionnaire to solicit input, not just wait for families to come to you to share it, but reach out, then you may miss some families who are not English proficient, families who are stressed about interacting with the school district in general, and so on. And so, I just want to call to your attention the need to be reaching out, and I know everybody is so busy, but to gather this kind of data so that you can let families know what their options are, it's really, really important. And then finally, and then I'll be quiet, I also just really hope we can stop using this language of choice about kids who stay in distance learning. For a lot of our families, it's not a choice. And I keep seeing this word being thrown around. It's not a choice if your child has cystic fibrosis. It's not a choice if your child is immune compromised from surviving leukemia. They're going to lose their classmates, they're going to lose their teachers. And I get it. Like, I don't know how to solve this problem, and I have no better ideas than the team of you working on the ground. But I think just don't frame it for families in this situation as if they're making a choice of convenience or something. It's not a choice. It's a health necessity. Or family members who would be more at risk, because, I have health factors, for example, and my kid, I'm the only parent. So him coming back would be, and he's a Berkeley High student, my kid coming back and getting COVID, he might be fine, might not have a single symptom, and I could lose my life, and he would then not have me anymore. So let's move away from that language. Thanks so much.
I don't disagree with that. Thank you, Sherry, for your advocacy. I really appreciate you.
And we have another live question coming from Stacy Brewer.
Hey, Stacy. I think you're muted, Ms. Brewer.
Okay, let's go back to Ms. Brewer, and we'll do Kim first. Kim Walton.
Hi,
Good
Kim.
evening. Hi, how are you?
Good, how are you?
Good, good, thank you. I've been to a lot of these town halls, and I'm very frustrated because my son is one of the 3,000 high school students that needs to be back in the classroom. And I go to a lot of these meetings so I can understand everything that's being said by the district. But hearing that this is a district-wide meeting about special ed education and students, and then my son who's received services, there's just no discussion about him being back in Berkeley High. What I would like to ask is that prior to setting up another town hall, when you have the information ready, give parents and the young adults time to read the information, to discuss it before having the town hall. Because I feel sometimes it's just this wham, bam, here's the meeting, bam, you throw up some slides, and you're trying to, understand everything at the same time. And then you have someone, my son is about to be 18. He needs to participate in this. He needs to understand. By you're not allowing him is taking away his ability to become a full citizen. So next time, you send out these surveys. I went to the meeting with the high school students and it was poorly attended. My son was there with me. I mean, it just feels as though that these 3,000 students, of which some of them, yes, have learning differences, are being ignored. He's going to his last year. I don't know if somewhere along the lines I'm going to have to possibly pay to have him do a 5th year in the independent school because gaps in his education, not this year, but in future years. But all I ask is that think about the students who receive special education in the high school for once. Okay, that's all I'm asking. Because over the past, I don't know how many months, we've been ignored. That's the way I feel. That's the way my son feels. And that's the way some of the other parents feel. Thank you.
Thank you, Ms. Walton. I'll jump in. Thanks for sharing the frustration. And I understand. It is the case that, we're sort of producing information almost every week. It was just last week that we were able to share news about our elementary schools and the reopening plan. I do expect that we're going to have news about middle and high school next week. I don't think that it's going to be a long wait. Our pledge is to continue on with these kind of town halls and make available opportunities for secondary families to get to know the reopening model. And so I get your frustration. I understand you've been attending and we really appreciate that. And news about the high school, very specific news about how the high school reopened, I think is just about a week away for our community.
Then I just also wanted to appreciate Ms. Walton's comment and just uplift the request that it's also interactive with our students, right? That the outreach be a little different. And we're very lucky on our school board to have a student director who's very active, and we'll make sure that happens. Thank you, Ms. Walton, for your comment.
I'll follow up. I received a lot of feedback that having the thought exchange 4 or 5 days earlier prior to the town hall was really helpful for parents. And the idea of processing it in the moment was difficult and made it harder to engage. So I would echo having some sort of input prior to the meeting would be great. I got positive feedback about that. And Eliza has another Q&A question.
Yes, so before I say that, I also want to let folks know it's on my count, my clock's at 7:53, and we had asked if we could do a summary or perhaps a follow-up of things to follow up on. But before I'm wondering what do folks want to do? Do we want to, or can folks extend the time a little longer for that summary before I read the question, or do we not have time for both?
Yeah, I'll be honest. Like my staff needs to go to bed. We need to be rested and get up tomorrow and start. I'm gonna, Brent, I'll leave it up to you, but I really,
yeah,
at 8 o'clock.
We've set up 2 hours. I think that we should try to honor that we, said that we would close the meeting at 8 o'clock.
Okay, well then in that case, I'm gonna ask Andrea and Carrie to help summarize some things that we would like to follow up on.
Yeah, we still have 6 minutes. We can get a couple questions in.
Or either way, I feel like there's a lot to process. I don't know if Andrea wants to jump in and try to do that, or if we just want to maybe Eliza or Vicky pick one last important question if there's anything crucial that we've left out.
Yeah, I definitely think asking another question versus doing a summary, we could follow up with families after the fact. Does Andrea, did you have another question that you wanted to ask?
Actually, Vicky, I would like to say, I'd like to ask for a follow-up before that. It's just the one comment is, I would like, it's very clear that there are a lot more questions about middle school and high school. But I would like for that not to be just a general town hall, but that if you're going to combine that information into one town hall, it really needs to have much more focus on special education, and rather than just kind of minimally tacked on, or hold a separate town hall for special education for middle and high school. And another follow-up that I would like to see is more conversations with families about measuring learning loss and how we're going to mitigate and recover that. Families need to be involved because of the funding that's coming in that we know is going to be targeted for students with disabilities. So I want those to be follow-ups.
Absolutely.
I could, just sort of say a word a little bit about the format. There's a few things that happened behind the scenes in preparation for tonight's meeting that I really appreciated. This town hall, I think, was a time in the making, but it really sort of began to come together a few weeks ago when special education staff and parents began to communicate about what the content of this town hall might be. It was very helpful to have the leadership of Vicky and Eliza and others, actually all of the parents who are with us, both propose the content, help us think about the format to be able to make it both meaningful and accessible. We do welcome staying in touch with all of the parent leaders who are on the call. We welcome making sense of this whole, this town hall experience with you, and then thinking ahead about further engagement with our community. So please know that offer to continue to partner, to provide information and opportunities to be together as a community stands on our part, and we'd love to continue to work with you on that.
May I make just another follow-up? Sorry, let me think of it. Everyone, would it be okay with you, Dr. Stevens and Mr. Mansinger, if parents who have additional questions that were not answered at this town hall contact you directly? Or what would be the preferred mode for getting specific answers for other questions? Thank you.
Of course, yes. I mean, but both of us are accessible, and that's also true for all of us staff. We do encourage those just to reach out. If it's a very specific question about your child, we encourage you to reach out to your case manager. If it's more of a programmatic concern, please do reach out to the department or to me.
Absolutely.
And then Sarah, could you share our web address? The recording of this will be available, I believe, in the next day or so, and additional information. We'll also link it to the BSEP parent website. And Sarah, can you share that? You have to unmute. Not everyone can see the chat.
Yeah, okay. Oh, yeah, it's bspedparents.org, and that's also in the chat.
And that's BSPED, bspedparents.org, which is also a listserv that many of you are familiar with, but if you're not, we encourage you to search that out. You can also, hopefully there'll be an updated link on the district's special ed website as well, linking to our site, where we're hoping to share the thought exchange information and answers and information that we get from the district as we receive it.
Yeah, absolutely. And I don't know if it's up there yet. It might be. Otherwise, I'll double check on that.
And just to add to that real quick, anyone who's participating can join us. Vicky, Sarah, me, and Andrea, and Eliza, we're just parents who really care about all of our students and kids. So if you're here in this meeting, don't feel like we're some important designated leaders. Anyone and everyone should please join us.
Definitely.
We have 2 minutes left. Oh, sorry, Sean, were you going to say something?
Oh, I was just going to wrap us up, but if you want
Well, I was actually going to allow Lindsay to ask her question in the last 2 minutes, if that's okay, Eliza.
I was just going to read her question.
Well, she raised her hand, so we could go ahead and let her ask live.
Hi. I'd like to thank everybody, number one, for hosting this and organizing it. But I have a question about next steps, which is, would the district be willing to help us reframe some of the materials that we get out to students in their IEP meetings, in their initial requests, to address some of these knowledge gaps that we have? And would the district be willing to kind of commit to having some more readable kind of documents that kind of address some of these big issues that a lot of parents are having?
Yes. That kind of feedback, Lindsay, is really valuable for us. I mean, if there are communications that we're putting out that just aren't hitting the mark, and you can help us do better, then please know that we welcome that feedback.
Absolutely. So there's just a quote that's been stuck in my head that I saw in one of our trainings the other day, and it's when little people are overwhelmed by big emotion, it's our job to share our calm, not join their chaos. And I really think forums like this and the advocacy that all of our families are putting into this is really helping that. So I just want to be very appreciative of all of you. You know, honestly, when I started this job, I thought, oh, this whole COVID thing is going to disappear. I'm going to be visiting schools and getting in those classrooms. And this year is just stretched on in this. And you know, I'm very proud of our community. I know it's rough. I know there's been a lot of bumps, but I also think we need to, you know, look at the work that we have done. And your advocacy as families is extremely important. And so I want you to continue to reach out. My supervisors on this, in front of you all, are very receptive. We text each other, talk about how to connect with families and build relationships all the time. So thank you for this evening. We really appreciate you, and we're looking forward to continuing this work together.
Good night, everybody.
Night, everyone.
Thank you all.